What's up, everybody? My name is Matty Willz. Welcome back to another episode of Wellbeing Wednesday with Matty Willz. Of course, this is brought to you by Metro Health. Conversations that we have on a regular basis with different representatives of Metro Health that you can find all around Greater Cleveland, and very important conversations. So without further ado, we'll kick off episode 5 already, which is kind of crazy, but welcome Dr. Neera Gupta to the show. Thank you so much for taking some time out of your busy day, and we appreciate having you.
I'm really happy to be here. Thank you.
Absolutely. So we first kind of just to let our listeners and viewers know that we didn't just pick you off the street. You are an accredited, you have all types of different titles behind your name. So why don't you just tell everybody a little bit about who you are and what you do with Metro?
Yeah, so I am a psychiatrist by training. So I'm a physician, and I specialize in treating substance use disorders. So I'm an addiction psychiatrist. So I work in a variety of different settings at Metro Health. I run our outpatient addiction clinics, and I'm also the medical director of Recovery Resources, where we treat patients with co-occurring disorders. So that's just a little bit about me.
And that's great, because all of those things are what we're about to talk about right now. So thank you
Yes.
for that. Without further ado, we'll get into the list of questions. I do want to start because this was, worded in a way that I felt was worth reading verbatim for all of our viewers and listeners. We also want to mention that those seeking help should first talk with their primary care physician for a referral to behavioral health, unless it is an emergency that needs urgent attention. So kind of like a disclaimer that we wanted to get out there before we got started. So we'll kick off with our first question, Doctor. What is the relationship between mental health and addiction?
So we do know that there's a very strong relationship between mental health issues and substance use disorders. We know that people with mental health issues are about twice as likely to develop a substance use disorder. And the reverse is also true. So people with a substance use disorder are about twice as likely to develop a mental health issue. So there's a very, very strong relationship, and that's why we call them co-occurring disorders.
Yeah, and that is kind of striking to
Yeah.
that the relationship between the two is that high. I mean, that's wow. I wasn't expecting that. So why are some people reluctant to seek the help that they need?
Well, I think there's multiple reasons. I think people are not aware that treatment is now available and it's effective. We have really done a great job with increasing access to care for these issues. But still, I think in some of our communities, people just don't know where they can go and seek help. So I think that there's that piece. I also think that the issue around stigma is something that um, leads to people being less willing to seek help for these issues. And that relates to society's view that, this is something that people need to just kind of use their willpower or their discipline to kind of push through. And we now know that those kinds of tactics don't work in terms of overcoming these issues.
Absolutely. And I mean, every episode, obviously, we talk about the stigma associated with anything related
Mhm.
to mental or behavioral health. So obviously that's very prevalent. But then also the first thing that you said was important too, that people don't know where to go. People don't know
Mhm.
that these places exist, which is, why I was so happy to be a part of the grand opening of the new center in Cleveland Heights a few weeks ago or a month ago, or
Mhm.
time just runs together now. But that was a very nice eye-opening experience for me. Not that necessarily that I didn't know, where they were, because maybe I haven't had to look for them so much,
Mhm.
but to know that there's one in our backyard and to see how beautiful and big and inviting it was just it was nice. So
Mhm.
definitely two great answers there. We'll keep it rolling. So what is the best way for family members to approach these situations with, or maybe a colleague or another
Mhm.
family member that they may need to look for some help in this regard?
Yeah, I think, I think everybody wants to help somebody who's struggling, but a lot of times, there's no clear instructions as to what is going to be helpful. But I would say one of the best things is to learn to listen without judgment. The important thing that people want to know is that they're not alone. That they can go through this process of getting help and getting treatment, but it's much easier when they know that they have support through the process. I think sometimes people feel like they have to have all the answers. Like loved ones have to have all the answers. The thing is this is a very complex issue, and very few people really understand, what's the way to kind of address it. But I think people aren't even seeking, that kind of support from family. I think they just want that listening ear. They want to know that they're not alone and they don't have to walk through this process alone. So that goes a long way.
Absolutely. And then, speaking about communities and speaking on the community and the family that I was raised in, it wasn't that we didn't necessarily come outright with these things, right? I mean, it was almost like, my dad, God rest his soul, he was a man's man. So, you kind of just toughened up and
Hmm.
stiffened the upper lip when you were around him in certain regards. So I'm sure that has something to do with it as well, just not being as open to it. So we need to keep having these types of conversations so that we can encourage people to be more open to
Hmm.
listening and encouraging and helping. So you mentioned stigmas earlier, and this question goes right back to that. Within our community, within our own houses, in our families, what can we do to reduce the stigmas associated with seeking help for these issues?
Yeah, I think one thing is that's really important is to educate ourselves, and to better educate. And nobody needs to be an expert in these areas except for the experts, but to understand that this is a disease. These are diseases that affect the brain and affect specific neurotransmitters in the brain. And after a certain point, it's not a choice. It's not a choice that people are continuing to use substances. It's not a choice that people are continuing to be depressed. That this is a brain issue and deserves treatment just like any other medical condition. So I think that education, I feel, is one of the best ways that we can beat through the stigma. The other thing is being aware of our own unconscious biases, based on how we were raised or based on, things we've seen in the media, and getting an increased awareness and checking those, and then, approaching people in a way that we feel is the right way, not just based on conditioning or how we were raised.
Absolutely. The age-old saying of knowledge is power, right? The more you know, the more educated decisions you can actually make. So
Right.
we to end our conversation today, we'll
Yeah.
take it back to the brand new behavioral health center that just opened in Cleveland Heights. Again, it was very beautiful. If you
Yeah.
haven't checked it out, then swing by there, right there, 107 Circle. I said it so many times that day. I
Yeah.
remember the address. But we're talking about, and in the first question, we talked about the relationship between substance abuse and then mental health. What exactly does the new behavioral health center in Cleveland Heights? What is their plan to combat both of those things?
So the new hospital is going to be really important in addressing our most vulnerable patients, our patients who are the most psychiatrically ill, with co-occurring disorders, and so puts them in a very unique position of really being able to stabilize these patients, and treat them comprehensively so that then they can step down to our outpatient programs and back into the community. So it's a huge improvement for a community to be able to stabilize people who when they're at their most desperate. And it's going to be great for the continuum of care we can provide.
Great. Again, another really informative, really great conversation with another representative of Metro Health.
Mhm.
We've been doing this segment now for a few months. I think that each and every person that I've talked to, obviously, you guys are all experts in the things that you cover, but just to be able to say it in a very matter of fact and plain way and have these kind of easy conversations, I think goes a long way. So I appreciate you, Dr. Gupta. I appreciate everyone else with Metro Health that we worked with. And did you have any closing remarks? Did you want to throw anything else out there before we wrap up?
No, it's just if you're struggling, please seek help. Help is now available. We have a lot of trained individuals ready and willing to help people who are struggling. So don't give up and reach out.
That's it. She said it. Thank you so much, Doctor. And thank you so much for watching us. And we'll be back with another episode soon. Take care.